Hello friends, I'm Dr. Meena Mishra. We are in the midst of a big second wave of COVID-19 pandemic, and our vaccination status in India has been as low as 7% as reported in the media. Now vaccine has been introduced several months back, but what is the reason that despite government's mechanism and machinery in place and so much of advertisements, the people are not turning up for vaccinations? A lot of it is because of the false information that is circulating through social media and WhatsApp. So I have come across one such WhatsApp message that claims to be scientifically oriented and wants to give a very scientific bent to this fake news. That's what I want to dispel and through this video. In that message, the first point that they have against vaccination is that vaccine should be given to healthy people, and it is actually contraindicated in people who are diabetics, suffering from hypertension or chronic heart disease. This is totally false information. All published literature worldwide where vaccines are considered to be safe, and a very small percentage, sometimes as low as 0.001% of the people who are vaccinated undergo reactions. So whenever we are vaccinating at such a mass level, one has to see and properly weigh the benefits versus the adverse effects. One has to realize that even the medications that you are taking, something as simple as a vitamin supplement, can cause serious allergic reactions in certain individuals. But the percentage is low, and that is the reason why medications are given, and that stands true for any of the medications that are prescribed to you by the doctors. There is always a chance of allergic reaction, and nobody knows in whom this reaction is going to occur. The same stands for vaccines. If you go through all the literature that is associated with vaccines are even prescribed in people who are immunocompromised. Now, people who are diabetics, hypertensive, or having chronic heart disease are not immunocompromised. They do not come in the condition of immunocompromised, and even if they do, they are prescribed vaccines. So what are the contraindications of a vaccine? The only contraindication to vaccines is having an allergic reaction to the first dose or any of the components of the vaccine. One has to be very, very particular and sure about this before you even inculcate this thought in your mind that the COVID vaccine is not safe for you. No doctor would give you advice, his or her patients, or to the general healthy population that you must undergo vaccination. Whereas so many doctors all over India have been saying that from the very beginning, that the only effective tool in our armamentarium against the fight with COVID is a vaccine at the earliest. The second point that is being made in this WhatsApp message is that people who are having vitamin D3 deficiencies should not be given the vaccine. And they have given some scientific literature or jargon associated with it as evidence, so that it becomes more convincing to those who read. Well, in fact, that is not true. What is actually true is that it has been seen in several studies during the last 1 year, 1.5 years, that those people who are vitamin D3 deficient have a greater likelihood of developing the severity of a COVID-associated illness like pneumonia. And that is the reason people are being prescribed vitamin D supplementation if they are diagnosed with COVID infection. And this is not true for vaccine. So please keep in your mind that vitamin D3 deficiency is not a contraindication for you to receive the vaccine. Then the other reaction aspect that is mentioned in this message is that people develop severe allergic reactions to this because they do not know that how much the virus has been, the virus that is injected in the vaccine, how low potency it is. It may even cause severe immune reactions in some patients. So, well, the news is, the scientific basis is that in fact, vaccine that you are getting is not only the dead virus that is being injected. This virus has been dead so that it is incapable of replicating in your body. It has been killed by several processes and mechanisms. But to stabilize it, several other chemical components are added in the vaccine, such as the stabilizers, certain proteins, sometimes glycol in some vaccines are added. And if you are allergic to these components, then that might trigger an allergic reaction. So it is not the virus which is going to trigger the live attenuated virus or the inactivated virus that is going to trigger this immune reaction in your body. It is the component of the vaccine that is going to trigger the immune reaction in your body. So if you know that you are allergic to any of these components, if it is already known, then it's better not to take that type of vaccine, and you may try out another vaccine. Different varieties of COVID vaccines are available now. But if you are not sure about it, then the only thing available to you right now and the best fight against COVID is the vaccine. So please, it is my strongest appeal to all of you to please not listen to any of these fake messages that are circulating in the form of videos or WhatsApp messages, but listen to the doctors, to all the renowned doctors, to all the big doctors of the country who are saying with one voice that the best fight against any viral illness or at present the COVID illness is the vaccine. And we are lucky enough, our scientific processes are so advanced now that we could develop a vaccine in such a short time. So dear friends, my strong appeal to you is do not listen to all these fake news and listen to your doctors instead. Wishing you all good health and vaccinate yourselves as early as possible. Thank you.